Hello friends, today we are going to discuss the basic anatomy of the internal iliac artery. Internal iliac artery is the most important artery in the pelvis, and for all obstetricians and gynecologists, understanding the anatomy is very important in order to save the life of the bleeding patient in obstetric and gynecological procedures. So to start with, these are the lumbar vertebrae, this is the sacral promontory, and these are the sacral bones. This is the common iliac artery, which continues as the external iliac artery. Now, internal iliac artery is the artery which is going deep in the pelvis. It is going deep in the pelvis, like towards the sacral promontory and deep, with the sacral bones. Now, internal iliac artery goes straight and continues as the uterine artery. It gives out a branch which goes towards the rectum. This is known as the middle rectal artery. Another branch going posteriorly from the anterior division of the internal iliac artery is known as the obturator artery. One more branch which is coming out of the anterior division is known as the vesical artery. And this internal iliac artery is continuing as the obliterated umbilical ligament. Now, to approach the internal iliac artery for internal iliac artery ligation, we have to go in between the infundibulopelvic and the round ligament, do retroperitoneal dissection. We have to take out the fear of retroperitoneal dissection from our minds. Lot of gynecologists and obstetricians have to understand that we should not be scared to go retroperitoneal and ligate the internal iliac artery. If we have ligated the internal iliac artery, we have literally cut the neck, uterus, and there will not be torrential hemorrhage. So once we go retroperitoneal, from lateral to medial, we have to remember all the structures. First is the external iliac artery. Next to it, a white structure with slightish bluish tinge, wide and big vessel is the external iliac vein. Third will be a very whitish structure with some areolar fat and showing peristalsis, which will be the ureter. And the medial most, which we have to ligate, is the internal iliac artery. Now, if you remember this, you will not make the mistake of ligating the ureter or the external iliac artery. Internal iliac artery needs to be ligated with a simple vicryl suture with a right angle artery. So, please remember this and control those cases with torrential bleeding, atonic PPH, gynecological bleeding, emergency bleeding, any kind of bleeding to save the uterus of the patient and save the life of the patient.